I mean, you have mitochondria in your brain,
Oh,
right?
you do?
Yeah, absolutely.
I thought it was only down here.
No, they're everywhere, in every cell in your body, right?
Right.
And so they're in the brain, and they are misfiring in your brain, or they're not making enough energy, causing things to misfire. And your sleep centers in your brain. I don't know. So kind of becomes a big catch-22.
Go to sleep, you little babe. 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 Your mama's gone away and your daddy's gonna stay. Don't leave nobody but the babe.
The mitochondria in your sleep center may not be making enough energy for you to produce the normal chemicals that get released to make you sleep properly. But then, the less you sleep, the worse the mitochondria function is going to be. So already you're starting with mitochondria that are not doing their job, right? So you can't sleep well, but then not sleeping well leads to more problems in the mitochondria, and it just keeps going around and around. And so
what should we do?
So you need to try to do whatever it takes to sleep.
Go to sleep, you little babe. 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 Everybody's gone in the cotton and the corn. Didn't leave nobody but the babe.
Okay, good. All right. I want you to knock yourself out, but in a healthy way, right? And there are medications that both of you take for sleep, right? And you can use some meditation, right? Some relaxation strategies at night. I don't want you knocking yourself out with things like alcohol, right? Or other drugs, or a head injury, right?
You're a sweet little babe. 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 Honey in the rock and the sugar don't stop. Gonna bring a bottle to the babe.
Treat yourself and get ready for sleep. Like have a whole sleep routine, right? So this is how we train babies to go to sleep, right? Like babies sometimes, they don't want to go to sleep. They're afraid they're going to miss something. They're all have energy. But then we do things, right, to kind of like set it up, right, so that they get relaxed. So a lot of babies take they get a bath at night. They get a warm bottle. They get their blankie. They get all of the nighttime things in place, and then their brain starts learning, oh, it's time to go to bed. Fingers here?
Go to sleep, little babe. Go to sleep.
You don't like wiggling, huh?
Go to sleep, little babe. Go to sleep. You and me and the devil makes three. Don't need no other loving babe.
We may really have to work on this nighttime routine for both of you, right? Which, as much as I want you exercising, I don't want you exercising right before bed. You know why? Because your heart rate goes up and your body's releasing all kinds of chemicals that help your heart rate go up and get exercised. And a lot of people feel, even though exercise can be tiring, your body has just made a lot of adrenaline. It's hard to put all of that away. So I don't want you exercising right before bedtime.
Go to sleep, you little babe. 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 Everybody's gone in the cotton and the corn. Didn't leave nobody but the babe.
If you sleep too much during the day, you will end up sleeping. You will end up staying up at night because you've already used up all your sleep for the day. You don't feel that tired. So if you can, I would try as much as I can not to sleep during the day. Or even if you take a nap, make sure you have an alarm or something, or 2 or 3 alarms, so that you get out of bed. Right? Because if you keep sleeping, then nighttime comes around, you're not going to want to sleep.
Go to sleep, little babe. Go to sleep, little babe. Go to sleep, little babe. Go to sleep. You and me and the devil makes three. Don't need no other loving babe.
Together. If I could do one thing for you, it would be to help you fix your sleep and have you get a good night's sleep, because it's just like my iPhone, right? I can't have my iPhone when I go to bed at night. My iPhone's down to 20%. I don't plug it in overnight. What do I think's going to happen? It's not going to be recharged for the next morning, right? So your sleep is your opportunity to recharge your mitochondria.
Right.
It's precious. It should be the one thing that you are focusing on the most, if you can. So I don't know what else we can do, but that sleep
So
has to
sleep
be
is
sacred.
Number one.
Sleep is number one right now, absolutely. And we'll see, maybe we'll start some magnesium, and the magnesium will help a little bit at night.
Okay.
But whatever you have to do, right?
I do have a routine.
Yeah.
I take my meds around 11, and then I try to be in bed by 12, and then right before I go to bed, I take the melatonin, and then it takes me about, I don't know, on a bad day, 3 or 4 hours.
Yeah. Do you ever get tired before all of this? Because this sounds pretty late at night to me, right? 11, midnight. Do you ever get tired earlier, like 9 to 10 p.m.?
A little bit. But.
Yeah. So here's what I'm wondering. Are you missing your window of opportunity to go to sleep? And then if you don't go to sleep between 9 and 10, when you first start feeling tired, you get a second wind, and then all of a sudden you're up for a few more hours or longer. Right. So you may want to really start thinking, just start noticing, I wonder what time I start getting tired. You don't have to do anything about it yet. Just notice naturally what is happening. And then you may want to say, you know what, forget this 11 p.m. thing. I'm moving my meds to 9. I'm taking my melatonin right then or a little bit after, and I'm taking advantage of my body's natural time to get sleepy. Because you may be missing that window, and then you have to, fight it. Because once we get a second wind, forget it. You're then in bed 2, 3 in the morning, waiting for something to happen, right? And your body's like, yeah, you should have done this a few hours ago. So start noticing when you start feeling sleepy, and then let's see if we can move your bedtime to that natural period. That makes sense, right?
Yeah.
Go to sleep, little babe. Go to sleep, little babe. Go to sleep,